What exactly is neurofeedback?
Neurofeedback is a form of biofeedback that using electrodes, we get a readout of what the brain is doing.
So it's a picture of the brain.
It's a picture of the brain. We see what it is, what it's doing. We know through research that certain parts of the brain are supposed to produce faster waves. Other parts of the brain are supposed to produce slower waves. And oftentimes there's an imbalance or a crossover where the one that's supposed to produce faster waves is producing slower waves. So that changes the person's ability to function in an appropriate way. And once we help to rebalance that, they function in a much more appropriate way.
Neurofeedback is a form of biofeedback. It's using your mind to control bodily functions. And in the case of neurofeedback, we train the brain. We actually retrain brain waves, or the amplitudes of brain waves and the location of brain waves. And then we can teach them how to change some of the things in their brain. For example, if they have slow brain waves, as is typical for children with attention deficit disorders, we can teach them to make those slow brain waves go faster.
You place sensors on the brain. I guess I'm a little bit clearer example, but we just use a little bit of paste and put the sensors in a couple different parts of the brain, and we can immediately start tracking electrical activity. When I say electrical activity, one of the things I think a lot of us lose sight of is that the human body we're electric, okay? When we move, there's an electrical impulse in our muscles.
So you attach sensors to the head, which
Right.
are attached to a computer.
Right.
But nothing comes in from the computer.
Nothing at all. It's all monitoring.
It is kind of amazing to think that your brain can control what's happening on a computer screen.
Regular biofeedback is you get, for instance, you might have a thermometer on your hand and you're watching the numbers go up. That's a visual feedback. Okay. With neurofeedback, there are brain waves that are measured. They go into your computer, and it comes out as visual feedback and also auditory feedback.
So you can actually see what your brain is doing.
Yes. Yes.
But nothing comes into your brain from the computer.
No. No.
So it's not dangerous.
No.
You're not getting shock treatment.
No. No. I always tell people that your job is to shock the computer.
Oh, right. How do you know what the brain needs? And how does this all connect to things like depression or other problems that people may have, ADD or other things?
People usually come in with a problem, and we then refine it and ask questions. We have some questions that we need to know more about their nervous system. And we also do a little assessment, a brainwave assessment, to see whether certain areas are functioning in the right way or not. We want to see if certain patterns exist, because if there are some patterns are correlated with various conditions, such as depression has a certain pattern, or anxiety, you'd see a certain pattern. ADD, you see a certain pattern. And if you see that pattern, you want to be able to change it to the more appropriate pattern.
What you actually do then is take a picture of the brain and then compare it to other pictures that you have in your database.
Yes, the computer does that on a digital level. We digitize the EEG. We call it a quantitative EEG. And that enables us then to take that data and compare it to data that's been stored in the databases. We have a normative standard database, and that gives us a difference map to show us how that patient's brain is functioning either above or below what patients' brains are doing who do not have that particular type of disorder. In knowing where the location is of over and under activation, we can then later do what we call neurotraining or neurofeedback.
What do you do when somebody comes to see you? How do you decide if that person is a good, let's say, candidate for neurofeedback?
There are many parts to that discussion. A lot of it has to do with the goals and desires of the client. If they know nothing about neurofeedback and it is one of the options for treatment, I'll explain it in the context of all the things that we could do. If they've come focused looking for neurofeedback, we'll explore whether it's really appropriate for them, whether it meets their needs in terms of their schedule, their time.
Some people just want to get started with neurofeedback. So I just give them a slew of assessments to do.
I talk to them about their history, get to know them a little bit. I do an assessment, a brainwave assessment, because what I need to know is what kinds of overactivity, underactivity is generating their difficulty.
After that, we'll discuss it with the family, see what we need to do, and then set up sessions.
We set up a game that the brain has to play. It has to achieve those goals that are defined within the paradigm in order to play the game, and in the process the brain learns. And probably what happens is the brain creates proteins as it learns. Those proteins change structure, structure changes neurotransmitter levels, and voila, we have a brain that can do on its own what we've been trying to do with drugs for many years.
Okay, it doesn't hurt, right?
Oh, we're attaching an electrode that's a sensing electrode. It doesn't go into the skin, it doesn't put anything into the skin. It's simply a sensor picking up electrical activity from the brain.
So the information is going out
into the computer creates a response based on what we've asked the computer to look for. The response is fed back to the brain says, I understand, I got to hear the tone, I got to see the picture move, whatever software we're using, I got the response, which is a reward. There's usually a visual reward and an auditory reward that says, you did good. And the brain says, I like to do good.